and welcome to this episode of the Your Health is Important Facebook Live broadcast. I am Dr. M.J. Collier, host, producer, and on-air personality, and we are here live to answer your healthcare questions. Remember what we like for you to do. Let us know who you are, where you're logging in from, so that we can be the best that we can be in reference to you. So thank you so much for tuning in tonight. We know that you have choices and options, and we're going to see if we can exercise them. So thank you so much once again. Now, let's get to the hot topic. The hot topic is your mask. Are you going to be seeing this now? Are people going to be wearing masks? That is the question. And it was announced earlier this week that actually it was last week, now that I think about it, it was last Tuesday, that masks were no longer required on airlines, or that the mandate for masks from the White House had been vindicated. And a Supreme Court judge said that it was beyond the scope of the White House to have a mask mandate, so they eradicated it. When that happened, people were ecstatic, losing their minds. I happened to be at the airport when the gate agent announced that on this flight, masks will not be necessary or mandated, and that you could take off your mask if you like. People were literally cheering in the stands. Then, an announcement that really kind of shocked me and took me aback, and that announcement was, they said, if or something to the effect of, do not harass people that have made the personal choice to continue to wear their masks. In other words, they were making the people wearing their masks the outsiders, the weird people, the people that should be mocked, ridiculed, etc., and the people that chose not to wear a mask to be celebrated. I think that culture was absolutely incredible, inappropriate, and something that just was beyond my comprehension. But we are where we are right now. They are appealing the loss of the mask mandate, but by the time the appeal goes on, we would have been beyond the period. They only asked for 2 more weeks for people to wear masks, pretty much through the middle of May, to get through spring breaks, proms, a lot of social gatherings, and then the weather would change, and hopefully we would have a better outcome. But with the appeal process in place, it may be a while. Let me see if we can get ourselves together here. So thank you so much for tuning in today. If you have been upgraded, Miss Boland, thank you so much. Good evening. We appreciate you checking in. You know, you are one of my favorites. We love Miss Boland. Billy Sue Combs from Middletown, Texas. All right. I was in Texas earlier this week, and going back this weekend. Show Big Time Greens. We love you. Thank you so much for tuning in. Miss Audrey Shanae, thank you from Nolens in the house, baby. Thank you so much. Sean Big Time Green again from Monroe, Louisiana. That's what we want to hear. We have Louisiana in the house right now. Hello from Rock Hill, South Carolina. Ernest Gibbs, a regular once again. Tawana Walls from Garland, Texas. Boy, Texas is really representing today. We really want to make sure that everybody knows this. And everyone, we are back. All right. Now, let's get into it. And we'll come back and let everybody know. From New Orleans, we got Rachel Harrison. Thank you so much. We appreciate you as well. We got, again, from Douglasville, Georgia, Miss Makila Bowling, my favorite, Makila. Okay, Yolanda Adams. Hello from Mississippi, MISS. Okay, I see Miss Miller. Hello from Memphis, Tennessee. North, South, East, and West. Daquet Wilson. Hello, where are you from? Let us know, please. Good evening, Stevie Griggs. Stevie Griggs, thank you so much for tuning in as well. We want to see if we got anybody from North. Okay. Toby Martinez. Hey, Doc. Is Terry good enough? Regina Robinson Fletcher. Hi, Miss Regina. So good to hear from you. I see you on Facebook posting on the regular. You really know how to put your pictures out there. We appreciate that. Okay. Giles Neal. Hey, Giles. Thank you so much. We appreciate you for tuning in. Giles is from the local area, of course. Andrews Jones. Good evening, everyone. We thank you for tuning in. Now, I'm going to come back to the roll call, but let's talk about a few things. I revealed at the last show that I had been undergoing a weight loss journey that started in January, and I was 30 pounds down. And I took the plunge last week for the first time, bought clothes that were smaller because my current clothes are ill-fitting, do not look appropriate. So I bought 3 new outfits, 2 dress suits, 1 casual. Got a lot of compliments. I had a chance to wear all of them in the last week or so. A lot of compliments. Everybody say they're fitting good. I recently done some remodeling in my business office, Atlanta West primary care as well. So today, one of the patients said, "Oh, it looks really nice in here. Everything's brand new, including you, Doc. You've been redone as well." I thought that was a pretty good compliment, that I have been redone and you too can be redone, because weight loss improves every health condition that you have, and maybe things you may not think about. Depression is improved by weight loss. High blood pressure, diabetes, high cholesterol are improved by weight loss. Joint pain, particularly pain in the hips and knees, because your body is not bearing as much weight. So you feel better, you can carry yourself better, you rest better. All those things are benefits of having a weight loss. So 30-pound weight loss, I'm still there. Have not gained, even though I think I did eat and drink more over the past week. I attended a lot of social functions, and at those social functions, food was in abundance, and so were libations and other beverages. So I did not hesitate to eat, but I embraced the feeling of fullness, and as soon as I felt that I had eaten enough, I stopped eating. So I was afraid, literally, to be honest with you, to step on the scale on Monday morning, because I was concerned that my activities during the previous week had resulted in a substantial weight gain. And amazingly enough, they had not. There was no substantive change in my weight. I thought that maybe I gained a pound, if that, but I don't think so, because by the end of the day, my weight was back to where it was. So I got through the week now, and now we're starting to resume a more usual and customary eating pattern. The thing that I am maintaining is the intermittent fasting. Ergo, I eat everything that I'm going to eat within one 8-hour period, whatever 8-hour period that is. I try to do it between 10 and 6 p.m. So 10 a.m. and 6 p.m. And again, it's not as important what you eat as it is when you eat it. But if you want to eat smartly, you want to have at least 30 grams of protein as a part of each meal. That's usually your entrees. That's your fish, your chicken, your beef, whatever you're going to choose. 30 grams of protein total in your meal, and then supplement that with fruits and vegetables. The more crunchy the fruit or vegetable is, the more healthy it is for you. It also keeps you regular, and you want to maintain regularity. So the intermittent fasting product, and then I'm using the Lipodrops Max strength, the maximum strength Lipodrops before each meal, and then the Keto Max. So taking the Keto Max to keep my body in a high metabolic state and to continue to metabolize fats and not store fats. Now, we have those, and then we have Dr. Collier's Trio, of course, that I recommend that everybody take every day to optimize your health. That is vitamin D, at 5,000 international units per day. That's a Doctor's D product. The omega-3 fish oil, our product is 1,480 milligrams per capsule. The capsules are crystal clear and do not smell fishy. One twice daily with meals. I eat one with either breakfast or lunch and dinner. And then probiotics, God's gift to good health. Probiotics do so many good things for you, including beating the leaky gut syndrome. I think I told everybody that we're doing blood allergy testing now, and we are able to test you for food allergies in the office. And what we're finding out is a lot of people have so many food allergies. Let's say it tests you for 50 things. Of those 50, you may be allergic to 40 to 45 of them. Now, I'm not talking about having full-blown anaphylaxis, breaking out in hives, shortness of breath, coughing or wheezing. What I am talking about is baseline inflammation in your gut that will result in increased abdominal girth. In other words, you start to store fat inside your abdomen, which is not a healthy condition. You're not able to metabolize and digest your foods appropriately, so you have a sense of dis-ease or disease or unsteadiness or unstateliness in your stomach. So people go, they get the $1 million workups, they're diagnosed with all kinds of things like irritable bowel syndrome, which is not even a real diagnosis. It's just a description of your symptoms. People are told that they're gluten intolerant and they go on these gluten-free diets. It has nothing to do with gluten, or gluten just may happen to be a part of some food that they're allergic to. And if they just avoid that, they have a much better digestive process. Their food goes down. They don't have bubble gut or the queases or borderline just, again, a sense of dis-ease after eating. And you don't have to think about what you eat. Remember the good old days when you were young, you could eat hot dogs and chili dogs with onions and have a milkshake with it and had no consequences and you slept like a baby. Well, those days are gone. We don't have that benefit anymore. I want to make sure that everybody was aware of that. And I know it's not just me, it's as we age, we suffer through some changes. And one of those changes is the inability to digest certain foods, or let's put it this way, you can't tolerate them the way that you did previously. So we're on the journey. We're continuing those things. I'm doing my Dr. Collier's Trio for Life, and that is the omega-3 fish oil, the probiotics, and the vitamin D at 5,000 international units per day. To maintain my weight loss, I'm using Lipodrops Max as well as the Keto Max. And that's what we're doing. We're going to update you and let you know. If I start to backslide, I'm not going to be shy about it. I'm going to say, hey, Dr. Kai, you gained 3 pounds or 5 pounds. One thing I can state unequivocally, and this is what I tell all of my patients in my weight loss facility. If you have lost weight and been successful losing weight, that's not the hard part. The hard part is maintaining the weight loss. I can get almost as much weight off of anybody as they want to lose. The problem is where you're going to be in 6 months. And what we don't want to do is lose 30 pounds and gain back 40 pounds. And that's what happens to a lot of people because they stop doing the things that they did to lose the weight, or they just resort back to even their normal circumstances. And then because their body has shifted, the metabolism goes back and they start to gain weight again. So as soon as I see, if I put on 3 to 5 pounds, I'm going to strictly resume dieting protocols, and I ought to be able to get that off in less than a week. It's only when you wait until you've gained back 15 or 20 that you're now going to have, it's going to be much harder to lose that weight the second time or the third time because it's just more difficult process. Keeping it off is much easier, and 3 pounds, 5 pounds, you can knock it back off with no problem. But a lot of people, they start backsliding and they start ignoring the scale, compromising for it. Oh, I had this event and that event, and I'll start back dieting next week. And that's not what you want to do. You want to maintain some consistency in what you're eating, when you're eating, and to maintain a weight loss, which is a much more healthier lifestyle. So you don't have to become lacto-vegetarian. You don't have to become vegan. Those are good lifestyle choices, of course, but oftentimes people cannot maintain them. Those people that do, it is a religious experience almost. But think about the many times that you may attend an event and you can't have, they have surf and turf. You don't eat the turf. You only eat the surf, or you don't eat any of it. You have to get a vegetarian plate. It's a lifestyle choice, and you don't have to be vegetarian to be healthy. There are healthy food alternatives that are protein now: fish, chicken, turkey, all those things. I'm not even I don't look negatively on red meat. I think that as a part of your diet, in moderation, you can eat red meat when cooked appropriately. And with no substantive consequences. So there we go. Let's get on with the show now. This is the People's Show. We want to answer your healthcare questions. So you definitely lost a lot of weight in your face. Thank you very much. I have, and my collar is still loose. So I'm going to take the plunge and buy some smaller shirts that are body fitting. I had to get regular fit, and now I'm going for the slim fit shirt. So thank you so much. And you let me know if they don't look good on me. Okay, Mrs. Todd Jr., is Lipodrops effective on visceral fat? Yes, it's most effective on visceral fat. Our key phrase is lose the muffin top with Lipodrops. Now, so let's be specific about what we're speaking about. When you have fat in your stomach, it can be below the muscle, inside your and around your organs, or it can be on top of the muscle, which is when you're pinching an inch of fat. There's good fat, there's yellow fat, and there's brown fat. Brown fat is the healthy type. The yellow fat is one that's most appropriate, most attached to disease processes such as metabolic syndrome and diabetes. So our objective is to change your metabolism and lose that fat. And it's been shown that when you do that, your health improves, your metabolism improves, all of your organs are no longer being strangled by fatty tissue around them, and you're just healthier. So the answer to the question is yes, it will help with peripheral fat. It helps you lose fat from places you cannot traditionally exercise the fat away from, like under your chin, across your back in your bra line, ladies, or the abdominal area, the pinch and inch on the outside of the thighs, the saddlebags, the inside of the thighs where you don't want your thighs rubbing together. All of those things are areas that no matter how much sit-up crunches, pulls, any exercise you think of, you'll have thick muscles underneath a layer of fat that can be inches thick because you're not metabolizing the fat. You can strengthen those muscles. There are lots of people who do crunches, crunches, crunches. And they literally have a six-pack in their abdomen, but you can't see it because there's too much fat on top of the muscle. So either of those circumstances are ones where you want to lose that fat, be more fit appearing, and have that muscular definition that makes you appear healthy. Next question. Okay. What do you suggest for prediabetes and inflamed liver? One, basic anti-inflammatories, vitamin D, which is a natural anti-inflammatory, the omega-3 fish oil, which is very good for the inflammation in the gut in particular, and probiotics. So those three things, Dr. Collier's recommended trio, are ideal for the pre-diabetic condition and inflamed liver. But when you have an inflamed liver, that is cirrhosis. You can have cirrhosis of the liver that is alcoholic. You can have non-alcoholic cirrhosis. You can have fatty liver. All of those things, cirrhosis means inflammation of the liver and deterioration of the liver tissue. The liver is one of the few organs in the body. The liver and the kidneys can regenerate themselves and heal themselves and replace unhealthy tissue with healthy tissue if given the opportunity to do so. No other organs in your body can do that. Once your heart goes bad, your heart goes bad. Once every other organ in your body goes bad, they go bad. But the kidneys can regenerate themselves into a healthy state, as well as the liver. So those are things that you can do for prediabetes, maintaining your weight as normal as possible, as close to your respected BMI as you should be, and limiting the amount of carbohydrates that you eat. A keto diet is actually very good for the pre-diabetic state. It was thought that the keto diet would have a negative effect on prediabetes and possibly convert a lot of people to full-blown diabetes. But that was myth. The science showed that the keto diet was very effective in converting people from prediabetes to a non-pre-diabetic state. Now understand this, pre-diabetes is not a diagnosis. Either you're diabetic or you're not. It's kind of like being a little bit pregnant. Either you have it or you don't have it. So not having it and giving people the category of prediabetes is just kind of a call to action that says if you continue doing what you're doing, whatever that is, you're going to march in the direction of diabetes, particularly if you have a strong family history. If your parents, your grandparents, your brothers and sisters are all diabetic, and you're pre-diabetic, you need to be very conscientious about what you're eating and maintaining a close to as ideal body weight as possible so that you don't become diabetic. Ladies, if you had gestational diabetes during any of your pregnancies, and by definition, that means you got diabetes while pregnant, you have the baby, the diabetes goes away. But a significant and substantial number of ladies that had gestational diabetes will convert to full-blown diabetes in their middle ages because they are genetically predisposed to do so. So you definitely have to make sure that you are conscientious about what you're doing when you have either prediabetes or gestational diabetes. Next question, great question. Okay, Billy Sue Combs. What could be causing upper stomach pain? I've had a colonoscopy and endoscopy. I'm still anemic, and now my doctor wants to do a camera peel. The camera peel is amazing technology. You swallow a pill, and it literally takes pictures of your entire intestines. As soon as you swallow it, it starts taking pictures. It continues to take pictures throughout. If you are anemic, you are bleeding from somewhere, and it sounds like the pain is coming from your GI tract. Now, having had a colonoscopy and endoscopy, they have ruled out things that are inside the cavity of the colon and the esophagus. They have not evaluated the small intestines, unfortunately, because the scopes don't go that far, but the camera does. So that is a good logical next step into evaluating what's going on with you. In the meantime, you need to take something to keep your stomach acid under control, and those would be H2 blockers like Pepcid AC, and then proton pump inhibitors like Nexium or Protonix. There's several on the market. They are all very good to give yourself some relief. There's also medications that you can take that will coat the inside of a stomach with a foamy type coating that you take before each meal and at bedtime. So all of those are things that you consider, and be conscientious about foods that you know when you eat X, whatever that is. It may be a spicy meatball, it may be pizza, that you're going to have a lot of stomach issues. Jen, don't eat those things. Anything that's difficult to digest, it takes a lot of acid from your stomach to get through. And that would be things like pizza with extra cheese or big, thick steak. Think about foods that are easy to digest, like chicken or fish, or even things like applesauce, etc. Things that are easy on your stomach. I would also get food allergy testing. The blood allergy test literally requires 1 drop of blood. That may be the answer to all of your problems, and all these diagnostic tests that you're getting are not answering the question. So a blood allergy test is something that can be added routinely when they're monitoring your blood count. Since you're anemic, they can also take a drop of that blood, put it on a card, and get a food allergy testing to see if it's something else going on. So keep us informed, Billy. So we want to make sure that you maintain a good state of health. But remember what Dr. Collier said to you. You cannot go wrong by taking the omega-3 fish oil, the probiotics, and the vitamin D. Those will help improve your health no matter what your disease state. No matter what your age, no matter whether you're male, no matter whether you're female, no matter whether you have 5 things wrong with you or nothing wrong with you, you will be more healthy imbibing upon Dr. Collier's trio for good health. So go to the website, lipodrops.com, and look at our Dr. Collier's recommended trio for good health, and then also any of the other products that are on the Lipodrops site that will improve and enhance your health status. Next question. Okay, that's Daquet Wilson. What do you recommend for postmenopausal women? Premenopausal man? No. I recommend bioidentical hormone replacement therapy, not just hormone replacement therapy, but women that are menopausal need hormone replacement to maintain a state of good health. The traditional treatment is an estrogen product called Premarin. And then if you still have a functioning uterus or a uterus that needs to be protected, you'd also would take a product called progesterone. Those 2 things are baseline artificial products, pharmaceutical products that will improve your health. But bioidentical hormone replacement therapy is a much better way to accomplish that objective without some of the potential side effects and with so many other benefits that it can literally be life-changing. For women that are premenopausal or postmenopausal, what bioidentical hormone replacement therapy will do for you? It will make you lose weight. It will make you sleep better. It will increase your muscle mass. It will decrease your body fat. It will increase the thickness of your vagina. So your vagina is now thick and tight, and your vagina will be moist and wet and ready to receive when having intercourse. So no painful intercourse, no discomfort. You will have intercourse pleasures. The level of your orgasms will increase 1,000%. So if you've never had one, you're going to be shocked and surprised. If you have them on occasion that are, they're okay, you're going to have super orgasms now and really, really change the way that you feel about your partner and the way that you feel about life. Because indeed, the things that we do, we dress better, we get a higher education, we try to make ourselves more attractive to the opposite sex to get a higher grade of partner or somebody that we think is higher grade or someone that we think we're attracted to, so that they will also be attracted to us. The bioidentical hormone replacement therapy also makes you the alpha female or the alpha male. It works for men as well. So you have more self-confidence. There are so many intangibles that just make you the best you that you can be. It is literally like the fountain of youth. So these treatments are available all over the country, but just Google BHRT, bioidentical hormone replacement therapy, and get more information and find out what Dr. Collier is talking about. This procedure is something that I do perform in my wellness center called Ageless Atlanta. So if you're a local or willing to travel and want to come see me, we'll be happy to do that. But there's probably a provider in your area that can also enhance your life. This is big science now and things that are going to be life-changing. Unfortunately, insurance companies are not on board with this as of yet, and so they're not covering the cost, but the benefits are priceless. And Dr. Collier's opinion is that within the next 5 years, these procedures will be covered by insurance companies because they enhance your health so significantly. They will ultimately save the insurance companies money by stopping you from being sick. You're going to be a long-term healthy person, and the only thing you're going to go to the doctor for is to have physicals and checkups and get great reports on how good you're doing versus going in with a long list of complaints and things that, oh, my aching back and my knees are hurting me and I just wish I could lose some weight and I feel so tired all the time. And men, they have at lunchtime, they got big plans. They call their wife and say, baby, I can't wait till I get home because tonight it's on. And they go home and eat dinner, and by 6:30, 7 o'clock, they're falling asleep in front of the television. And their enthusiasm is just gone because they just don't have it in them anymore. or they thought they didn't until they received bioidentical hormone replacement therapy. All right, next question. Okay, I have high blood pressure and I'm type 2 diabetic. And every time I see my PCP, she tells me that I have a little bit of protein in my urine. And a lot, not just a drop amount. What can I do to stop protein showing in my urine? Okay, that's Janoy Allen. You know what? The problem is that you have metabolic syndrome. I'm sure you didn't mention that you also have high cholesterol, but even if you don't, you should be on a medication that controls your cholesterol. You should be on a medication that not only lowers your blood sugar, but lowers your hemoglobin A1C, and then a blood pressure medicine that will protect your kidneys from the diabetes. Number one target organ for diabetes is the kidneys, and it can ultimately result in kidney failure and you being on dialysis. So by having protein in your urine, that is a clear indication that damage is being done to your kidneys on the cellular level. Proteinuria means protein in the urine. Normally, protein particles are filtered in the kidneys, but they are reabsorbed and they cannot get through the filtering system in your kidneys, and so they continue to circulate. When you start spilling these large molecules of protein that normally are too large to get through the filter in the kidneys, that shows that the filter has been damaged. So think about back in the good old days when you go visit your grandparents in the country and they wouldn't have air conditioning, but they would have a screen door. And the screen door's purpose was to allow you to look out, but also to keep the bugs out of the house. Well, that they worked just wonderfully until some bad little kid would take a pencil and start punching holes in the screen door. That is effectively what happens when you have high blood pressure. That pressure, every time your heart pumps, boom, 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 is punching on the filter in your kidneys and ultimately puts a hole in there that's large enough for those protein molecules to escape. So it is a very easy indicator that lets you know that damage is being done to your kidneys by the uncontrolled high blood pressure and the diabetic state. The diabetes just makes the kidneys more fragile and more susceptible to that damage. So you have to control both disease states. You can't treat one without treating the other, because this is what happens. There are newer, better medications that are available now that can protect your kidneys. Several of the diabetes medications have shown major benefits with kidney, particularly the SGLT2 class of medications. Ones I can think about are Jardiance and Farxiga and Invokana. Those three things, there's another one called Steglatro. Those four products are available. They all have indications to help prevent heart attacks, strokes, and also kidney damage from the diabetes. That is in addition to a class of medication called an angiotensin receptor blocker or an ACE inhibitor. These are antihypertensive medications that have great benefit in protecting the kidneys from the damage caused by diabetes and high blood pressure. So those are things you need to have a conversation with your doctor. Don't let them rush you in and out. Tell them you want to get this under control. It can be improved or treated, but the ideal thing that you do is control both disease states. Take your medications as prescribed. If they are not doing it, you might need to have to adjust medications, higher doses, or add additional medications, but whatever it takes, because you'll get to a certain point where the damage cannot be repaired. I stated earlier that the kidneys can repair themselves. They are one of the organs, the liver being the other, that can enhance and repair itself and give new tissue, neogenesis, creation of new tissue. But you can get beyond, you can get to a point of no return where the kidneys can no longer repair themselves, and then you have a condition called chronic kidney disease, CKD, stages 1 through 4. And once you get to 4, you're on dialysis, and that's what you don't want to do. All right, great question. Thank you so much. Okay, what is the leaky gut and what causes it? The leaky gut syndrome is caused by food allergies. And this is not, when people hear leaky gut, they think, oh my goodness, there's something in my bowels leaking, am I leaking out of my bottom? No, you aren't. That's not what happens. We're talking about on the cellular level. And we were just talking about the screen door analogy to a filter. Well, the lining of your intestines has a filtering mechanism that's just like a screen door. And as long as that's intact, those larger protein molecules that we were just talking about coming out of the kidneys can't get into the lining. So your body gets the nutrients that it needs from the foods that you eat, and the proteins pass through, and you don't get exposed to them. Well, when you get that same bad little kid punching holes in the screen door, and you get holes in that filtering system that's in the lining of the intestines, then large particles like proteins can get into and get exposed to your blood tract and your bloodstream, and your antibodies will recognize them as not being you. So it's like kind of getting a blood transfusion that doesn't match, or an organ transplant that's not appropriate, and you reject it. So your body recognizes cow proteins and pork proteins and all these other molecules and says, hey, this is not human. This is also not you as a human. So it starts to make antibodies against them. When you get those antibodies being formed, you get inflammation as the antibodies are attaching and trying to dissolve and destroy the protein molecules. And that inflammation causes problems in the gut. Your stomach tries to protect itself by increasing the amount of fat that's there, because that fatty lining can be protected. So that's the cycle of things that happens. Probiotics are amazing at repairing the leaky gut. And I tell my patients, I say, get your food allergy testing, take probiotics for 6 months, and then repeat the test. And half the things that are on there, maybe even more, will fall off the list because your body is no longer being exposed to them, because the holes that have been punched in the screen door have been repaired, and those molecules are not getting in there. Not getting in there, your body doesn't respond to them. Ergo, no inflammation, no leaky gut. So that is what that is, and that is an elegant description so everybody can understand what we're talking about. But it's not complicated. Medicine is not complicated. I tell my patients that all the time. It's been said that if a doctor will listen to the patient will tell you exactly what's wrong with them. So you have to actually take the time to listen before you make a predetermined diagnosis. But also, when people go to the internet and they Google WebMD and those sorts of things, and they come in already knowing what's wrong, and they just want me to give them a second opinion, now I got to tell them not only why that's not correct, but I got to explain to them why it's not correct. Now we've gone through all of our visit time and haven't accomplished anything other than me telling them that it's not what they thought it was, based on going down a primrose pathway. When you're on a site like that, it'll ask you a few questions, and depending upon how you ask them, it will lead you and direct you down that path. That may be an inappropriate pathway. I will know that, and a good healthcare provider will know that immediately. But the computer is dumb. It's only the information that you give it that it makes decisions. They call it GIGO, garbage in, garbage out. So don't get your healthcare information from Dr. Google. This is why we're here right now, providing you healthcare information, because we're trying to keep you informed. And don't just keep it to yourself. Share it with your friends. Tell your friends to tune in. Tell them to go to my YouTube site and watch the videos. We have videos on a myriad of topics that we can talk about as far as health is concerned, or have them come on and ask their healthcare questions. This is what we're here for, to answer those questions that people have, so you can get the real information and the rest of the story. All right, next question. I need something to crave my sugar cravings, or to cure my sugar cravings, and I have a bad pain on my left side. The pain is unbearable. The pain on your left side needs to be evaluated, because pain is always an indication that something is wrong. When you say the left side, I'm presuming that you mean your abdomen. If it's higher, the left side in this area, the flank area, is where your left kidney is. On the other side is your descending colon. So what's on that side is where you put the most stress on your bowel to have a bowel movement. And the most common condition that causes pain in that area is a condition called diverticulosis. Diverticulosis is like having one appendix or multiple appendices or hundreds of appendices on that area that each one can become individually inflamed, infected, and may require a surgical intervention. Most commonly now, they're able to and will respond to high-dose antibiotic therapy, but sometimes you have to cut out that segment of the colon. Now, there are other things that can do it as well, but common things happen most commonly, but it needs to be evaluated. So you're probably going to have to get either a CT scan or an MRI, possibly a colonoscopy, again, basic urine testing, etc. But don't walk around having severe pain. Something's not right with that. Your sugar cravings are your sugar cravings. I think that the Lipodrops help with that, because they cut your cravings in general. But when you're craving something, you have to literally make a conscientious decision to not do that thing that you know is bad. So if you're craving sugar, desserts, ice cream, whatever, just make a decision not to do it. But that doesn't mean you have to do it all the time. You can enjoy things in moderation that will give you life's simple pleasures. We enjoy eating. Eating is what we do. We socialize to eat. We go on dates to eat. We have dinner dates. We go to dinner and a movie. We have dinner meetings. We like to eat as part of our social fabric. So it's important that you're able to enjoy those things. You just have to do it in moderation and make sure that you're eating the healthy items. But it's okay to have a piece of key lime pie or cake or, or tiramisu or whatever it is that you like on occasion. You just can't have key lime pie, tiramisu, and ice cream for dessert because it's there. Or, you have multiple slices of various things, or you go around the table and get a piece of everybody's dessert when you're in a group environment. You can't do that. And embrace the craving and the hunger and just say to yourself, I would like to get it, but I'm not going to get it. One of the things that one of my more intelligent friends told me when I was about to embark on this weight loss journey was that you're going to have hunger and you have to embrace the hunger. So once I adopted that attitude, particularly the first week or so, it was difficult. But as time goes on, your stomach shrinks, you become less hungry, and you're not craving things the way that you had as you're detoxing your body from things like sugar. You just feel better about it. You could backslide on occasion. I felt the need. I say, oh, I really want to get a dessert. I really want to do that. I just have to make a decision not to do it. Sometimes I don't make the right decision. I'm going to be honest with you. But more often than not, I will. And the result is, again, a sustained weight loss. And that's what we want to have. Great question. Okay. What do you suggest for fibromyalgia pain? Oh boy, fibromyalgia is a bugaboo. Fibromyalgia, one, there's no test for fibromyalgia, so it is a diagnosis of exclusion. When excluded by fibromyalgia, that means you have the diagnostic criteria is you have to have migrating pain. That means it's on your upper body and your lower body. It's on one side or the other side or all sides. So all of those things that go into the diagnosis. You can have some positive tests like an elevated sedimentation rate or SED rate. That is a test for inflammation in your body. There's another test called a high sensitivity C-reactive protein, or HSC reactive protein. You can also do things like an arthritis profile, rheumatoid factor, all kind of tests that can let you know whether there's inflammation in your body. None of them are specific for fibromyalgia. Again, it's a diagnosis of exclusion. The primary problem is inflammation. The best therapy are natural anti-inflammatories. That would be your vitamin D at a high enough dose, 5,000 international units per day to modify the inflammatory process. The omega-3 fish oils, you want to try to get as close to 4,000 milligrams per day. Most of the capsules that are available over the counter are 1,000 milligrams. So you take 2 in the morning with food, 2 in the evening. You don't have to take it with food. It's just absorbed better and easier if you take it with food. And then there are other things like curcumin and turmeric. These are all natural anti-inflammatories, but they are food products and spices. They come in everything from sprinkles to put on your food like salt and pepper to things that you can make out of. You can make into tea. Some people have them already pre-prepared. Some people have them pressed into tablets and capsules. So a lot of things you can do that are natural. Then you can also take prescription medications, anti-inflammatories, Motrin, Advil, or Aleve, or naproxen, ibuprofen, those types of products, Celebrex or cephaloxibid, which is very easy on the stomach and good for that sort of thing. Sometimes the pain is overwhelming. You have to take pure pain medication. So whichever you prefer. But fibromyalgia is a process. You need to work closely with your doctor and your provider, and y'all should be good friends because this process, it cannot be cured as of yet. But the symptoms can be controlled, and but it's going to require you to have a great partnership with your provider to be the best you that you can be. Also, monitor the things that you eat. Eating natural, again, more fruits and vegetables, the more crunchy it is, the better it is for you. So all of those things, having a good life nutrition, making sure you're getting enough rest, meaning hopefully 8 hours of sleep per night, which is very difficult to get. Most adults actually get close to 6 if they're lucky. But if you can get up to 8 hours, that will help change your lifestyle, decreasing your stress level also. So if you have stresses in your life, which could be children, spouses, significant others, family members that are high stress, sometimes you need to limit your exposure to those individuals and don't let them impact you in a negative way. So there we go. That's a great question. Thank you so much. Okay. Let's see here. Hello. Why does all of my blood work have a high RDW? I'm not sure what that means, a high RDW. in doing so. So give me a little more breakdown on that, and then we'll talk about it. I don't know what that acronym RDW means. What do you recommend for bariatric patients? And I apologize, I'm having difficulty seeing the screen here. See if I can enlarge it. There you go. What I recommend for bariatric patients. If you have not had a procedure, the procedures that are most common are the gastric sleeve and the gastric bypass. The gastric sleeve is a much more anatomically appropriate and easier procedure, and it can easily be reversed if you need to. What a gastric sleeve is they take your stomach, which is when you're large, usually expanded and stretched to about the size of a 2-liter Coke bottle. Okay? They fold it down on itself until it's about the size of a banana. So you have less absorptive area, and you have less place for food to collect. So you have an early sense of satiety. You literally cannot eat as much. And that's a very quick and easy process. What they have found, and this is what is amazing, they call this procedure the surgical cure for diabetes, because there are people that have bad diabetes on insulin. 3 days after the procedure, they're off insulin. Now, why is that? They have not lost enough weight in 3 days to have reversed the diabetic process, but there's some neurohormonal connection to the stomach lining, and the pancreas and the state of diabetes that is corrected when you do that procedure. So the surgical cure for diabetes can be a bariatric procedure. The second is the gastric bypass, the root and wire, where they totally reroute your stomach. The actual stomach space now becomes about the size of a closed fist, and they reroute small intestines, the esophagus, etc., so that you just don't have a space for food to collect. And that is a much more dramatic process, many more side effects, including explosive diarrhea. If you eat the wrong foods, that is uncontrollable. You will not be going to the Golden Corral after having a gastric bypass, because your stomach won't be able to tolerate it. And usually people can have gallbladder issues as well, because it kind of changes the plumbing of the biliary tree, which is where the the fluid in the gallbladder, the bile, comes into your stomach to help you digest fat. So there's not a lot of space for the fat to accumulate. So high fat foods and foods that are difficult to digest can cause major problems with that. But they are both effective, and you need to discuss with your provider, your bariatric specialist, who's done lots of these procedures. You don't want to be the first one that has it done by somebody who went to Las Vegas for the weekend and learned how to do it. You want somebody who's been tutored appropriately, has had multiple procedures guided under a more experienced hand, and has a lot of experience doing this. The procedure itself, if you've seen the television show My 600-Pound Life, Dr. Niazi does the gastric bypass in the majority of these patients, but he also does the gastric sleeve as well. But for patients that are that big, it is literally not just life altering, but life saving, because they just have no quality of life. They just can't function, and it can really help a lot. So that's what I recommend. But it's a lifelong commitment. You have to take vitamins, because you don't have enough absorptive area in your stomach to absorb your basic vitamins. So you have to take vitamins, sometimes liquids, to do that. But it can improve your health markedly if you need to lose, I would say, more than 100 pounds. But you can accomplish that objective. We get 100 pounds off of people all the time with the lipo line. Now, if you got more than 100 pounds, then and you don't want to take the time that it takes, because a process like that will require 15 pounds to 20 pounds weight loss per month. And depending, you multiply that by the amount that you need until you're out there. It may be a year, maybe 2 years, but it will happen. Gastric bypass will result in much more dramatic weight loss and give you what you want quicker, and reestablish the normal state of good health. All right, great question. Okay, this is Paula Davis. What causes vertigo? Oh, vertigo, boy, is a curse. Vertigo is dizziness, basically, where there are two types. One where you feel like the room is spinning around you. The other is like you feel like you're spinning and the room is still. Both are very unpleasant, because you can't orientate yourself, and can be associated with sometimes severe nausea, projectile vomiting. But you can't walk. You try to walk, you're listing and falling up against the wall. You can't function. You can't drive, because you can't orientate yourself. We don't know what the cause is of vertigo. We do know that the basic problem is inflammation in the inner ear. There are 3 cochlea, 3 bones in the inner ear that are an orientation. One is straight up, one is straight down, so 90-degree angle, and then one is about 45-degree angles. Those three things are what orientate you and your body to your position. That's why you can close your eyes and know that you're standing up, that you can tell when you bend your head down, etc., without looking and without being orientated in space. You know where things are because of that inner ear. Well, the inner ear is lined, it's got fluid inside of it, and it's got little hair-like projections that are very sensitive nerve endings that help. When that fluid moves, it tells those nerves where you are. The nerves send that interpretation to the brain, and that's how you know you're orientated. But that fluid can become infected, it become inflamed, those nerves can become inflamed. So the basic problem is inflammation. The inflammation can be caused by a viral infection, a bacterial infection, other causes of inflammation that are not infectious at all. And when that happens, these are the people that usually have long-term vertigo. Most people will get vertigo and you can do nothing and it runs its course in 10 to 14 days. Other people can be aggressively treated. Nasal sprays, antihistamines such as Allegra, Zizal, Claritin, Zyrtec, Benadryl, even decongestants, to decompress the area, antihistamines, etc. There are anti-dizziness drugs. The most common is called meclizine or Antivert. It's available over the counter in a low dose and prescription strength in a higher dose, and it gives marked relief to most people and helps them get through it. Once they're through it, again, they recuperate it. And we really just don't know why that happens. But again, there's some people that have almost chronic vertigo, and it is literally a curse. There was a pitcher that was drafted by the Atlanta Braves, one of his highest paid contracts in the history of baseball. On the way here, he developed vertigo, never pitched a day. He tried to go to spring training, couldn't throw the ball, couldn't pitch, couldn't do anything, and it became a chronic condition for him. He never recuperated from it. And it was a tragedy for the Braves franchise, but also for him because it took away his career, his professional career as a baseball player. And they never, of course, he had every specialist known to man, and they couldn't figure out what was wrong with him. And so it's other than calling it vertigo, which is what the condition is. It's literally just a description of the symptoms that you're having, not a disease state or a diagnosis per se. So that's where we are with that. I treat my patients with anti-inflammatories, antibiotics, non-sedating antihistamines, sometimes steroids, and throw everything at them depending upon how severe their symptomatology is. And again, the vast majority of the time you could do nothing and you'll get over it in a few weeks. Oftentimes, Dr. Collier will treat aggressively. That will cut down the period of recovery time, and you do better. And hopefully it won't recur. I tell my patients, even once your symptoms are gone, you might want to stay on medications for another week or so that you have an extended period of normality and not let that disease state settle in and it flares up on occasion. And that's what you don't want to do. So great question. Vertigo. All right. What can I do to help my arthritis pain and lymphedema besides losing weight? Okay, let's not dismiss losing weight. Losing weight is the number one benefit that you can do for that. It helps with arthritis pain. It helps with lymphedema, which is retention of fluids. When you have less body, there's less fluid to accumulate and to collect. Lymphedema, particularly in the lower extremities, is almost just a function of gravity. As you stand, fluid collects and it's not being successfully recirculated back to your heart so that you can either urinate it out or just keep it in your body circulation. So compression socks or stockings, I like over the calf men's support socks. They're a very inexpensive way to treat that problem and keep your legs, because it keeps the skin compressed. There's no space for fluid to collect, and it's inexpensive. You don't have to go to the doctor to get them. You can get them anywhere. Over the calf, men's over the calf support socks. There's nothing different about men's socks, ladies, so you can get them yourself. But when they're a lady support sock, for whatever reason, they're more expensive. But you ought to be able to get 3 pair of men's socks for $20 that are really high quality, will last you for years. You can get them in any style, color. They can match any outfit that you're wearing, and just wear them all the time to keep that edema from happening. And then on occasions when you got to go with your legs out, or you can't wear the socks, then you get through it, and as quickly as you can, you put those socks back on to help doing that. You have to monitor your sodium intake, because salt will allow your body to retain more fluids, and you want to make sure that is not the case, that you're doing that. So monitoring your diet, eating clean, eating lean, but also losing weight. Losing weight is again the #1 recommendation. So sounds like Ms. Adewale that providers you've seen to have always suggested that you want to lose weight, and so don't dismiss that as an option. That's one of the things that's in addition to, not instead of, other things you can do besides keep it compressed. There are physical therapy facilities that specialize in lymphedema that can help you. You get into a program, you go 3 or 4 times a week, and I've seen them work miracles in relieving that fluid, because it can be again very challenging to do basic stuff like stay in your shoes as the day goes on. As your ankles start to swell and your ankles are sticking outside the shoe, it's uncomfortable, unpleasant. But if you take the shoe off, your feet will swell. You can't get the shoe back on. So all those sorts of little practical things that have to be taken into consideration with the disease state of lymphedema. So again, no magic out there. I wish there was some magical thing that I could tell you about, some super laser therapy or whatever, but there isn't. Lymphedema is a long-term chronic illness that has to be treated as on a daily basis, continuously. As soon as you become lackluster in your treatment, then you're going to have more of a problem. It will recur. Okay. Any other questions? Okay, I want more info on Lipodrops. I gained 14 pounds in 8 months. Okay, Betty James, you got the COVID-14. Most people put on 15 to 20 pounds in the last year because of decreased activity level because of COVID. We also probably were eating more. Remember in the first part of the pandemic when you were basically stuck at home and you were Netflix and chilling, and once you watched everything that Netflix and all the other cable channels had to offer, you really had nothing to do. So you were sitting in front of television and eating and sitting in front of television. So decreased activity level, increased calorie count. A lot of people also were drinking a little more alcohol than they normally do. So that all resulted in a increase in weight. Most people between, I call it the COVID-15, but some people it's 20 or 25. So Lipodrops will be great to help assist in your weight loss journey. So the Lipodrops is a product that you place under your tongue before each meal. The dropper will measure the exact amount. You squeeze the bubble on the end, it will pull up to a line on the dropper, perfect amount every time. You squirt it under your tongue. You hold it under your tongue for 2 minutes, and then you swallow it. Lipodrops are the same medication that weight loss facilities, medical weight loss facilities will offer you as an injection called Lipovite, which is a combination of amino acids that help your body metabolize fat. Well, a lot of people very successful. Most weight loss places, I still do it at my weight loss facility. We give those shots, but some people can't come get the shots regularly. You need to get it at least once a week, no less than every 2 weeks. But if you can't get it every 2 weeks, then you're wasting your time, energy, effort, and money. So what people will do, everybody starts off with a lot of enthusiasm. They come in weekly, they're doing great, they're losing weight. Wow, life is wonderful. But then life intervenes. All of a sudden, they got to go to soccer practice, or they got to take their kids to, after school, this or that. And they start missing appointments. And once that happens, then you lose all the benefits that you were getting from the Lipovite injections. So Dr. Collier and a couple of my friends, Mr. Gabe Everson, Dr. J. Goldclaim, we came up with the same formulation in a sublingual technique, meaning you put it under your tongue. When you take a medication under your tongue, it is as effectively absorbed as if you had an injection. And it's absorbed in a very short period of time. You only have to hold it under your tongue for 2 minutes. There's no pain, there's no discomfort, and it's just like getting the shot. And you can do it every day. So we put it in a bottle, called it Lipodrops, and all of a sudden, you don't have to go to the weight loss clinic on a weekly basis now. You can do the Lipodrops at home because each bottle has a 1-month supply in it, and you get the benefits of doing that. And you get the success with your weight loss from participating in that program. So go to the website. There are other products that might make it easier for you. Our Keto Max, which will put your body in a state of semi-ketosis, which is basically the Atkins type diet phenomena, or the keto diet that everybody talks about, without actually having to follow the keto diet. You get the ketones from other natural substances. Again, probiotics, which we highly recommend. We have a lipo cleanse that helps you once you start to lose the weight. A lot of the things that are stored in your fat are now stored in your gut. And you don't want that to be inside of you. You want to get rid of that. So Lipo Cleanse will cleanse out that product so you're having large, easy to pass bowel movements. Instead of once a day or once every other day, particularly for the ladies, you'll probably be going after every meal, and you're going to be shocked and surprised as to how large these bowel movements are and how flat your stomach is once you've got eliminated all of that waste. No bubble gut, no gas, no bloating, so to speak, just a flat stomach because you have decompressed your intestines. It's thought that people carry around 5 pounds or so of waste in their intestines, and a product like the LipoCleanse, which is not a laxative. It does not give you uncontrolled bowel movements that you have to hurry up and run to the toilet. That's not what it does. It gives you great benefit in a variety of different ways. So again, the LipoCleanse product is one we recommend. The probiotics to establish normal gut flora and help with your digestion. The Lipodrops, which change your metabolism and allow you to metabolize fat and lose fat in areas that you cannot traditionally exercise it away from, like under your chin, across your back, the back fat, in your bra area, your abdominal area. Lose the muffin top with Lipodrops, and then the inner and outer thighs for the ladies. That's where we are with that. So go to the website, lipodrops.com, learn how to lose your weight. Next question. What causes leg cramps? Paula Parks, Nance, leg cramps can be caused by a variety of reasons. Most of the time it's metabolic, and the most common metabolic abnormality is low potassium. Also, low magnesium can cause leg cramps. So one of the easiest ways to treat the leg cramps is to, one, make sure that you have enough sodium that you're intaking. So products like Gatorade, Powerade, even the increasing amount of salt that's in your diet that you're putting on your food will help. But to treat and block the leg cramp response, quinine is one of the most effective things that can happen. There used to be quinine tablets available. They are no longer available for some weird reason. But I was told by a naturopath and a patient, quinine is the key ingredient in tonic water. So when you like gin and tonic, vodka tonics, etc., the big bottles of tonic water at the grocery store for $1, you drink that tonic water, about 6 ounces every day. You can put lemon, you can put lime. It doesn't taste bad by itself, just on the rocks. I don't mind if you put some vodka in it if you like, whatever you like to drink. But if you do that every day, that should help with the leg cramps. If it does not, then it needs to be evaluated to make sure that there are no circulatory issues there, things like varicose veins or poor circulation. The legs start to cramp when they become oxygen starved. They become oxygen starved if the blood is not circulating in an effective manner to get there. So that might need to be the case. So if you have varicose veins on your legs, go to one of these vein clinics and have them evaluate you. They can do some ultrasound testing and let you know whether that is indeed the problem. But try the simple stuff first. The tonic water is a very simple and elegant way to do it. Again, about 6 ounces, which is a small cup every day. And after you've been doing it for about a week, the leg cramp should improve remarkably. Okay. This brings to an end this episode of the Your Health is Important radio broadcast, Facebook Live broadcast, rather. And we want to thank you for participating. It is always a pleasure to have you spend your Wednesday evenings with me. It is incredible that you choose to do so. All I can do is say thank you, thank you, thank you. I hope that you have benefited from the information that we brought to you. Tune in next time. Tell all your friends. We'll be announcing it, and listen to me on the Ricky Smiley Morning Show each morning. My first segment is 6:45 a.m. Eastern Standard Time, and then other segments depending upon what's going on in the world of health. Remember, your health is important. Thank you again.